and welcome to Safe Sprouts TV, the place where we chat all things baby safety and first aid. I'm your host, Kat Mason, and this is First Aid Friday. Today's question comes from Millie. She asks, "Hi Kat, last week my 3-month-old choked when I was feeding her. It was the most frightening situation because she stopped breathing and turned blue. I instinctively began giving her back blows and she started coughing again. I didn't know you could choke on milk. Was this right? It seemed to work. But now I have anxiety every feed that it will happen again. Millie." Millie, so stressful. And I can completely understand why you feel anxious. I don't know if you're breastfeeding or bottle feeding, but this can happen with both. And if it makes you feel any better, this is super common to have happen. Before we get into the treatment of what to do, I want to just clarify a few things. Firstly, let's chat aspiration and choking and what both of these terms mean. Aspiration is when we have any substance enter the airways that should have gone down the food pipe. These substances can be liquids or solids, and even stomach contents that have come up and gone back down the wrong way. Now, if someone aspirates on something solid, and this solid object either partially or completely blocks their main airway or trachea, then we call this choking. So to clarify this again, if someone aspirates on something solid and it stays in the upper airway obstructing their breathing, we consider this choking. So this solid object will either partially block the airway or completely block it. If this main airway is completely or very nearly completely blocked, then the person will be unable to speak, cough or breathe effectively, and this could even lead to unconsciousness within minutes. The first aid for someone who's choking on a solid object and who has an ineffective cough is to administer the back blows and chest thrusts similar to what you did. Moving back to aspiration. Aspirating on a runny liquid can't really block the main airway or the trachea in the same way that a solid object can, but in really little ones, depending on the amount aspirated, it can fill up their airways so that they'll be unable to breathe for a bit. For example, a newborn's airway is literally the same size as a straw. So if they have too much liquid pass into their throat and down into their airway, it doesn't take too much to fill this all up, causing breathing issues. More often than not though, the throat or the vocal cords will close over and prevent any more liquid entering the airways. So in either of these situations, which is the airway filling with milk or the vocal cords closing over, your little baby is not going to breathe effectively or at all for a bit. And this is when you can see that colour change. How I want you to manage your baby if they aspirate on their milk is exactly how you would manage choking. And I have a free choking guide if you need. I'll put a link to it in the captions below this video. But essentially, it's just going to be the same. So if your baby is coughing and spluttering, we'll treat this just the same as we would for a mild choking or a mild obstruction. So I want you to sit them up and lean them right on forward like this and support their head if you need, and allow them to try and clear their own airway by spitting out the milk or swallowing back down or coughing it up. It's really important that you don't have your baby laying on their back still, as the milk's just going to pull at the back of their throat, and it will be so hard for them to clear their own airway in this position. Gravity is working against them when they're laying flat on their back. Once your baby's airway is cleared, I want you to watch them closely for the next few days for any signs of breathing issues. If any fluid has entered the lungs, even if it's just breast milk, there's a chance that the lungs can become inflamed or infected. So any signs of trouble breathing or a fever, please chat to your doctor straight away. Okay, now for the tricky bit. If your baby's aspirated on milk and if they're not coughing or they've stopped coughing and they've stopped crying and they're starting to change colour to a blue, then we're going to treat this just as we would for a severe choking or a severe obstruction. So lay your baby across your lap and ensure that their head is pointing towards the ground. Don't forget to support their jaw as well. So head pointing towards the ground just like this. So I'm talking a serious downward angle here. Then apply the back blows just as you would for a solid object. So hitting them firmly between the shoulder blades 5 times. 1, 2, 3, 4, 5. After 5 back blows, flip them over, again ensuring that their head is lower than their body, and deliver your 5 chest thrusts. Remember, the same depth and the same location as a CPR chest compression. 1, 2, 3, 4, 5. Now, I know that there's no object stuck in the airway, and that's what back blows and chest thrusts are designed for, but I do think that these maneuvers have a place in this situation. This is because if the milk has filled up your little one's airways, laying your baby in these positions will allow gravity to help get the fluid to run back out of the airways instead of seeping further down into them. The back blows and chest thrusts can also help to create a pressure to expel this fluid out too. So gravity and pressure will hopefully help clear their airways and get your little one breathing again. So remember, it's 5 back blows, then 5 chest thrusts, repeating this until their airways have cleared, and ensuring that all times your baby's head is always positioned lower than their body. Now look, this is incredibly rare, but if your baby then becomes unconscious, I want you to just start CPR. So for anyone, regardless of age or circumstances, so anyone who becomes unconscious or unresponsive and is not breathing normally or at all, you need to start CPR. So to summarize, if your baby aspirates or gags on milk, look at if they're coughing or not. If they're coughing, just sit them up, lean them forward, and allow them to clear their own airway. And honestly, this is all you'll have to do the majority of the time. And make sure that you monitor their breathing for a few days to watch for signs of infection. Now, if your baby's not coughing or if they're changing colour, lay them across your lap, head pointing towards the ground, and begin the back blows, followed by the chest thrusts until their airways clear. And if at any point your baby becomes unresponsive, then put them onto a firm, flat surface and begin CPR. So Millie, I think you did a fabulous job. Your little baby was silent and turning blue. Giving her back blows was the right thing to do, and I can totally understand your anxiety. Please reach out to your GP or lactation consultant, especially if this happens again, and they might be able to look at reasons why it's happening in the first place and hopefully prevent a reoccurrence. Sending so much love to you. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more tips. And if you would like a first aid question, send it through to us at hello@safesprouts.com.au. See you next time.